Cervical spine rehabilitation first needs to address the long lever muscles of the spine. This is performed by placing the tubing around both hands and wrists in this fashion. Place the tubing around the stable structure. In 21 years, I've never had a doorknob ever break. Tractioning. Then stabilizing or strengthening by lifting the chest, touching the shoulder blades together and back, comfortable position, short, comfortable strength, range of motion. Adjust the tube tension as far as you can go without any pain or discomfort. Do it till it feels good, and then quit. McKenzie neck cervical release can provide a lot of relief and polish the cervical facet neck joints by taking 2 fingers. First, tuck the chin straight back. Place the fingers on the side of the chin. Lightly tip, not into pain. Placing 2 other fingers on the mastoid process behind the ear and lightly lifting. Distracting the cervical facets on the concavity. Be careful that you're not producing any pressure on the concave portion of the cervical spine. You can do both sides of the neck by tipping and lifting. This is a polishing action for the cervical facets. And if we lift, we don't apply pressure to the concavity side of the cervical facets. From here, strengthening of the cervical spine by performing a shrug. It can be performed with or without the tubing, bringing the shoulders up and squeezing the neck. Then taking the portion of your hands, of your 5th digit of your little finger, placing it bilaterally under the mastoid process of your neck, which acts as an axis. Overlapping your fingers in back, squeezing the neck to a comfortable pressure, lifting with the mastoid, and lightly polishing the cervical spine. Do this till it feels comfortable. The strengthening of the suboccipitals and the cervical muscles. Then lift the nose to create pressure on your fingers, strengthening the muscles of the cervical spine, and then short isometric contractions of the muscles of the upper cervical spine, the suboccipitalis. Doing it until it feels good, and that concludes the rehabilitation of the cervical spine. With personal experience of damage of the cervical facets, breaking 2 upper ribs on my left and separating my collarbone, I find that when I'm working in the office, I feel like I have a knife stabbing me or someone has their knuckle stabbing me in the upper ribs. I perform these cervical exercises without tubing still probably 15 times a day or more. I perform the stretches that we just showed by grabbing the left arm, stretching, pulling, tuck, tip, lift, shrug, hold, squeeze neck, lift, polish, lift to pressure, and I'm through. These exercises all can be performed like that in probably 15 seconds or less.